If you are over 60 and taking vitamin B12 every single day, but your energy is still collapsing, your memory feels slower, your legs feel weak, or your feet burn and tingle at night, then what I'm about to tell you may be one of the most important health conversations you hear this year. Because the real danger after 60 is not always vitamin B12 deficiency. It is something far more deceptive. Your body may have vitamin B12 in the bloodstream, while your brain and nerves are still starving for it. And that is exactly why so many seniors are told, your labs look normal, while their balance worsens, their fatigue deepens, and their confidence slowly disappears. I want you to think about that carefully. A nutrient your body desperately needs may be present, but unusable. And this hidden problem is becoming extremely common in adults over 60. I'm Dr. Richard Vance, and today I'm going to show you why millions of seniors are taking vitamin B12 the wrong way. The silent mistakes that block absorption and nerve repair, and the exact strategy many older adults use to finally support their brain, memory, balance, and energy the way they were supposed to all along. And stay with me until the end, because the final mistake is the one I see most often in seniors who say, "Doctor, I take B12 every day, so why do I still feel old?" Before we begin, tell me your age and where you're watching from today. And if you currently take vitamin B12, tell me which form you use: tablets, gummies, sublingual drops, or injections. Because what you choose may matter far more than most people realize. Now let's start with the biggest misunderstanding of all. Most people think vitamin B12 is simply an energy vitamin. It is not. Vitamin B12 is deeply involved in the survival and repair of the nervous system itself. Your body uses B12 to help create red blood cells that carry oxygen. It helps support DNA production inside cells. It helps regulate homocysteine, a compound linked to inflammation and vascular damage. And most importantly for seniors, it helps maintain myelin. Myelin is the protective coating around nerves. Think of it like insulation around electrical wires. When myelin becomes damaged or thin, nerve signals begin to slow down and leak. That is why early B12 problems often show up as tingling feet, numb fingers, burning sensations, poor balance, memory lapses, fatigue, brain fog, or even mood changes. And here's the dangerous part. These symptoms often appear gradually, so gradually that many seniors assume it's just aging. But sometimes it is not aging at all. Sometimes the nervous system is quietly struggling for years. I remember a patient in his early 70s who came into my office convinced he was developing dementia. He kept forgetting names. He would walk into rooms and forget why he was there. He lost confidence driving at night because his reaction time felt slower. He told me, "I feel like my brain is slipping away." And yet his blood work showed a normal vitamin B12 level. That's where this conversation becomes extremely important, because standard B12 blood tests do not always tell the full story. A blood test mainly measures how much B12 is floating around in circulation. It does not necessarily show how much is reaching the cells, the brain, or the nerves. And after 60, absorption becomes the real battlefield. Here's why. When you are younger, stomach acid breaks vitamin B12 away from proteins in food. Then a special carrier protein called intrinsic factor binds to the B12 and helps transport it through the digestive tract so it can finally be absorbed in the small intestine. But aging changes this entire process. Stomach acid often declines dramatically after 60. Intrinsic factor production may decline too. and this is far more common than people realize. In fact, many older adults develop a condition called atrophic gastritis, thinning of the stomach lining, which reduces acid production over time. Think of stomach acid like scissors. Its job is to cut B12 loose so your body can use it. Without enough acid, the vitamin may simply pass through unused. And here's where modern medications make the problem even worse. Millions of seniors take acid blockers for reflux. Others take metformin for blood sugar control. Some take antibiotics repeatedly. All of these have been associated with lower B12 absorption over time. So even though someone may swallow B12 faithfully every morning for years, their nervous system may still receive very little usable support. And this creates one of the most frustrating situations in medicine. The patient feels worse, but the labs look acceptable. Now, this is where the first major mistake happens. Most seniors choose vitamin B12 based on marketing, not biology. They walk into a store, grab the cheapest bottle, and assume all forms are basically the same. They are not. And this is where things become critically important after 60. The most common form sold in stores is cyanocobalamin. Technically, yes, it is vitamin B12, but it is a synthetic inactive form. Your body must convert it into active forms before your nerves and brain can actually use it. That conversion process depends on healthy liver function, enzyme activity, methylation pathways, and adequate antioxidant support. Unfortunately, many of those systems become less efficient with age, especially in people with diabetes, chronic inflammation, fatty liver, digestive issues, or metabolic decline. So what happens? The supplement enters the body, but conversion may be slow or incomplete. And this is where methylcobalamin becomes so important. Methylcobalamin is already active. It does not require the same conversion steps. Your cells can use it immediately. And this may matter tremendously for aging nerves. Research suggests methylcobalamin may better support nerve regeneration and neurological function in certain individuals because it participates directly in methylation reactions important for brain and nerve health. Now let me explain why this matters in simple language. Inside the nervous system, cells constantly repair themselves. They rebuild proteins, maintain myelin, regulate inflammation, repair DNA, produce neurotransmitters. All of that requires energy and biochemical communication. But aging slows those repair systems. And if B12 delivery is poor at the same time, the nervous system may slowly begin falling behind. This is why some seniors describe symptoms that are difficult to explain. They say things like, "I just don't feel sharp anymore. My legs don't trust me. I feel disconnected. My energy never fully comes back." And the deeper issue may not be age itself. It may be declining cellular support. But that's only part of the story. Because there is another hidden problem almost nobody talks about: the delivery method. This may actually be the biggest game changer of all. Most seniors swallow B12 tablets whole with water. That works reasonably well for younger adults with strong digestion. But after 60, swallowing standard tablets may become surprisingly inefficient. Why? Because the vitamin still depends heavily on stomach processing and intrinsic factor. And if those systems are weakened, absorption drops. This is where sublingual B12 changed everything for many of my patients. Sublingual means the vitamin dissolves under the tongue. Part of the B12 can absorb directly through tissues in the mouth instead of relying entirely on digestion. For seniors with low stomach acid, digestive problems, reflux medication use, or absorption difficulties, this can make a profound difference. I remember one woman, age 76, who had taken B12 tablets for nearly a decade. Still exhausted, still foggy, still struggling with numbness. When we changed only 2 things, the form and the delivery method, she called my office 6 weeks later and said, "For the first time in years, I woke up before my alarm with energy." Now let me be very careful here. This is not magic. It is not an overnight cure, and not everyone responds the same way. But biology matters, and after 60, small biological barriers can create enormous downstream consequences over time. Now here's another mistake that silently destroys progress: inconsistency. Many seniors treat vitamin B12 like coffee. They take it only when they feel tired. But B12 does not function like caffeine. It functions like long-term cellular support. Nerve repair is slow. Myelin rebuilding is slow. Mitochondrial recovery is slow. And this is where mitochondria become important. Mitochondria are the tiny energy factories inside cells. As we age, mitochondrial efficiency naturally declines. Inflammation increases. Oxidative stress rises. Energy production slows. That's one reason fatigue becomes so common after 60. And vitamin B12 plays a role in helping cellular energy systems function properly. But if support is inconsistent, repair becomes inconsistent too. Imagine trying to rebuild a damaged road crew 1 day per week. Progress would constantly stop and restart. That is exactly what many seniors accidentally do with their nervous system. One patient told me, "I only take B12 on days when I feel drained." That approach may provide temporary stimulation for some people, but it rarely supports long-term neurological repair. When she switched to steady daily support, her symptoms stabilized for the first time in years. And this leads directly into another critical issue: time. Many older adults quit too early. They expect dramatic changes within days. But nerves heal slowly, especially aging nerves. In some people, energy improves first. In others, sleep improves. Then mental clarity. Then tingling decreases. Then balance improves. And the timeline can take weeks or months. This is where patience becomes medically important, because some seniors stop right before progress would have started. Now let's talk about one of the most overlooked biological enemies of B12 function: chronic inflammation. Inflammation is not always bad. Acute inflammation helps the body heal after injury or infection. But chronic low-grade inflammation is different. It acts like a constant internal stress signal, and after 60, many things can raise inflammatory activity: poor sleep, excess sugar, physical inactivity, obesity, chronic stress, smoking, metabolic disease. This matters because inflammation interferes with cellular communication and nutrient utilization. Imagine trying to send repair workers into a city filled with traffic jams, roadblocks, and smoke. Everything becomes slower and less efficient. That's what chronic inflammation can do inside the body. And here's where blood sugar becomes especially important. High glucose damages nerves directly. Over time, excess sugar creates oxidative stress, unstable molecules that damage tissues and blood vessels. Small nerves in the feet and hands are especially vulnerable. This is one reason diabetes and prediabetes are strongly associated with neuropathy. So if blood sugar remains uncontrolled, B12 may help support recovery, but the nervous system is still under attack at the same time. This is why a complete strategy matters more than supplements alone. Now let me tell you about another mistake I see constantly: taking B12 late at night. For some seniors, B12 increases alertness and mental energy. That sounds good, until it disrupts sleep, and poor sleep may quietly sabotage everything else. During deep sleep, the brain activates repair and detoxification systems. Hormones rebalance. Inflammation decreases. Cellular recovery accelerates. But chronic sleep disruption raises cortisol, the body's primary stress hormone. Elevated cortisol over time has been linked to inflammation, blood sugar problems, memory issues, and accelerated aging. So for many seniors, morning or early afternoon is often the better time to use B12 support. And hydration matters too. Many older adults live in a state of chronic, mild dehydration without realizing it. Thirst signals weaken with age. Some seniors intentionally drink less water because they fear nighttime urination. But poor hydration reduces circulation and nutrient transport throughout the body. Your nerves cannot efficiently receive support in a dehydrated environment. Now here comes one of the most important parts of this entire discussion. Not all numbness, fatigue, or memory decline is caused by B12 deficiency. And this distinction matters enormously, because some seniors keep increasing supplements while missing the real diagnosis. I once treated a man who doubled and tripled his B12 intake because his balance kept worsening. He became convinced he had severe deficiency. But imaging later revealed spinal stenosis. His spinal nerves were physically compressed. No amount of B12 alone could solve that. Others may have thyroid disorders, circulation problems, Parkinsonian symptoms, sleep apnea, depression, or medication side effects. This is why persistent neurological symptoms should always be properly evaluated. Supplements can support biology, but they do not replace accurate diagnosis and medical care. Now let's talk about the strategy I most commonly discuss with seniors who want to support healthy B12 status after 60. First, focus on the form. Many older adults prefer active forms, such as methylcobalamin or combinations that include adenosylcobalamin. Second, consider delivery. If swallowing tablets has not helped despite consistent use, ask your healthcare provider whether sublingual forms may be appropriate. Third, consistency matters. Daily support is often more effective than random megadoses. Fourth, timing matters. Earlier in the day may help avoid sleep disruption. Fifth, support the entire biological environment. Healthy blood sugar, protein intake, movement, sleep, hydration, stress reduction. Because the nervous system does not heal in isolation, everything is connected. And this is where the conversation becomes bigger than vitamin B12 itself. Aging is not simply about getting older. It is about whether the body can still repair efficiently. Can nerves communicate clearly? Can cells produce energy efficiently? Can inflammation stay controlled? Can the brain receive enough oxygen and nutrients? Those are the deeper questions. And sometimes what looks like aging is actually the gradual collapse of repair systems that were never fully supported. Before we finish, I want to leave you with one final story. A woman in her late 70s once sat across from me and quietly said, "I don't feel like myself anymore." Not sick enough for a hospital, not disabled, just fading. She had stopped gardening because she no longer trusted her balance. She avoided long conversations because she lost words too easily. And every afternoon felt like her brain hit a wall. She had taken vitamin B12 for years, but when we reviewed everything carefully, almost nothing about her routine matched the biology of aging. Wrong form, poor absorption, inconsistent timing, poor sleep, minimal hydration, high stress. We didn't change everything overnight. We changed the fundamentals. Slowly, her energy improved, her confidence returned, her thinking sharpened, and the fear in her eyes began disappearing. A few months later, she told me something I still remember. She said, "I thought aging meant losing myself piece by piece. I didn't realize my body was asking for support." That is the message I want you to remember tonight. Fatigue is not always just age. Brain fog is not always normal. Numbness is not always harmless. Sometimes the body is warning you long before serious decline arrives. And taking vitamin B12 the right way may be far more important than simply taking it at all. So tonight, look at your routine carefully. Ask yourself, am I truly supporting my brain and nerves? Or am I simply checking a box every morning? If this video helped you understand something important about your health, share it with someone over 60 who may still believe exhaustion, memory problems, or tingling feet are simply part of getting older. And before you go, comment below with your age and tell me, what form of B12 are you taking right now? And have you actually noticed a difference? I'm Dr. Richard Vance. Stay strong, stay steady, stay mentally sharp. And I'll see you in the next video.